So today we're going to talk about depression, and more specifically, how do we measure depression? So I'm Dr. Linda, a practicing psychiatrist, and after I've made the diagnosis of depression, it's helpful for me to actually measure it. And I'm going to tell you how I think about measuring depression. So there are 4 components that I think about when I work with someone. The first is the time period. The reason why that's important is because actually we don't diagnose someone with clinical depression until there's been a sustained period of time when someone's feeling depressed. So a lot of the times for a diagnosis, we actually use a period of time of 2 weeks. And that's because we know that, in the normal course of life's ups and downs, people's moods will go up and down. I might feel a little bit sad one day because something happened, and then a few days later that passes and I'll feel better again. And what we're looking for is actually more than half the days of a 2-week period where someone is actually feeling very sad or depressed for you to meet the criteria, the clinical criteria for a major depressive episode. So that's the first thing, is the time period. The second thing that I think about when trying to measure depression is actually how much distress is it causing someone. Depression is something that is actually difficult to tolerate. It's hard to be depressed, and we try to measure that by a level of distress someone is feeling. So for example, sometimes being depressed can be exquisitely painful. You're feeling withdrawn, you're not engaging with your children. The things that would normally bring you joy, you're not feeling any joy at all. And that sense of depression is actually quite worrisome for people. It's on your mind. It's bothering you that you're depressed. It's bothering you that you're not able to do the things that you normally enjoy or engage with your loved ones as you normally do. And we try to get a sense of that level of distress for people. And that's what we actually try to measure when thinking about depression. The third measurement of sorts that we think about when addressing depression is how much of an impact is it on your functioning. So when we talk about functioning, we're talking about how you're living your life. So if it is that you're a busy working professional, is the depression impacting you so much that you're not able to go to work? You're skipping meetings, important meetings, and you're missing deadlines, and you're almost going to actually get fired from your job. That's a big impact on your functioning. Or if you're a student, you're not able to get out of bed, and you're not missing your classes, you're not able to do your homework on time, your grades are starting to fall. That's an impact on your functioning. We also think about functioning in terms of your ability to relate in your core relationships. Are you so depressed that you're getting more irritable, you're getting more impatient, you're not even wanting to engage with your partner, you are getting more angry and frustrated at your children, you're starting to isolate, so not even texting your friends back when they want to do things with you? How much of an impact is it on your relationships? And those are things that we think about to get a measurement of depression. And finally, the last thing that we use, or I use in my practice, is something called the Patient Health Questionnaire 9. So it's the PHQ-9. It's an objective measurement of depression that was traditionally used as a screening tool, but actually we use it quite globally and very commonly as something to give us a measurement of the severity of the depression. And this is a pretty standard now form or question that we give out to people to get a sense of the severity of depression. And they consist of 9 questions, hence the PHQ-9, that covers a lot of different facets of depression. First of all, are you, feeling depressed? And we also look at the physical manifestations of depression. How does it affect your energy or your appetite or your ability to concentrate? Even, are you feeling sluggish? Sometimes the depression shows up in your body in terms of what we call psychomotor retardation. You feeling sluggish or slow, or even agitation. And finally, the PHQ-9 does have a very important question in terms of measuring if you have any thoughts about suicide as well, which is a very key thing that we want to make sure that we don't miss. So the 4 areas that I think about when trying to measure depression are, first of all, the time period. Second, how much distress it's causing you. Third, it's how much is it impacting your functioning. And also finally, in some form of objective tally in terms of the level of depression that you have, so I can keep track of that over time. And one of the reasons why it's important to measure the depression is I really want to know, what are we treating? Are we getting the depression better? Are your symptoms improving? I want to know if the level of distress is getting better. I want to know if you are actually able to function better and relate better in your relationships. And also too, I want to see that some of the numbers or the scores in your PHQ-9 are falling or dropping over time to make sure that we're not missing anything in our work together. And also too, if I get a good measurement of the level of distress or impact on your functioning, or even the score on your PHQ-9 from the beginning, it can help guide the treatment plan. And the reason for this is, let's say you have just mild levels of depression, then we might start off with lifestyle changes. We might start off with a diet and exercise and getting supports and some psychoeducation and some therapy. And I might reserve some of the medications, like antidepressants, for if your depression symptoms were more moderate to severe or not responding to some of these initial interventions that we did. So for me, it is actually important to think about how do we measure depression in our ongoing work together. Okay, see you next time.